When you're dealing with knee pain, you know exactly what I'm talking about. That sharp ache when you climb stairs, the stiffness when you stand up after sitting, the constant worry. Will this ever get better, or is this just my life now? I'm here to tell you something important. Knee pain doesn't have to be permanent. In fact, 90% of knee pain can be eliminated without surgery, without expensive treatments, and without a lifetime of medication. Over the next 15 minutes, I'm going to share 10 proven methods that have helped thousands of people just like you completely eliminate their knee pain. These aren't quick fixes or temporary band-aids. These are long-term solutions backed by science and real results. So grab a pen, get comfortable, and let's start your journey to pain-free knees. By the end of this video, you'll have a complete action plan. Let's dive in. Method 1, the quad strengthening protocol. Here's something most people don't realize. Your quads, the muscles on the front of your thigh, are the primary protectors of your knee joint. When your quads are weak, your knee has to absorb all the impact and stress from walking, standing, and moving. That's where pain begins. A landmark study from the Journal of Orthopedic and Sports Physical Therapy found that people who strengthened their quadriceps experienced a 65% reduction in knee pain within just 8 weeks. That's more effective than most medications. Here's the exercise that changes everything. It's called the straight leg raise. Lie on your back with one leg bent and the other straight. Tighten the thigh muscle of your straight leg and lift it about 12 inches off the ground. Hold for 5 seconds. Lower slowly. That's 1 rep. Do 3 sets of 15 reps on each leg every single day. Yes, every day. In the beginning, it might feel challenging. Your quad might shake. That's perfectly normal. That shaking means your muscle is waking up and getting stronger. The key is consistency. Don't do it for 3 days and then quit. Within 2 weeks, you'll notice your knee feels more stable. Within a month, you'll be amazed at the difference. Your knees will feel younger, stronger, and pain will start melting away. This single exercise has helped more people eliminate knee pain than any other technique I know. It's that powerful. Method 2, proper walking technique. Most people think walking is automatic. You just put one foot in front of the other. But improper walking technique is one of the biggest hidden causes of knee pain. Every step you take either heals your knees or damages them. Let's make sure you're doing it right. First, posture. Stand tall with your shoulders back. Imagine a string pulling you up from the crown of your head. This aligns your entire body and reduces stress on your knees. Second, foot placement. Your feet should point straight ahead, not turn out like a duck. When your feet angle outward, it twists your knee joint with every step. Over time, that creates wear and tear. Third, heel-to-toe rolling. Land on your heel, roll through the middle of your foot, and push off with your toes. This distributes impact evenly. Most people with knee pain either slam down flat-footed or land too hard on their heels. Fourth, step length. Take shorter steps, don't overstride. When you reach too far forward, it creates a braking force that pounds your knee. Shorter, quicker steps are gentler and more efficient. Fifth, engage your core. Pull your belly button slightly towards your spine. This stabilizes your pelvis and takes pressure off your knees. Practice this consciously for 2 weeks. Walk slowly at first. Pay attention to every step. Yes, it feels awkward initially, but then it becomes automatic, and your knees, they'll thank you with every pain-free step you take. Walking correctly is free medicine. Use it. Method 3, the ice and heat protocol. Let's talk about inflammation. When your knee hurts, there's almost always inflammation involved. That's swelling, redness, heat around the joint. Inflammation is your body's alarm system, but when it becomes chronic, it causes pain and damage. Here's the protocol that works. Ice for acute pain and swelling, heat for chronic stiffness and achy knees. Most people use them backwards, and that's why they don't get results. If your knee is swollen, hot, or you just injured it, use ice. Grab a bag of frozen peas or an ice pack. Wrap it in a thin towel and apply it to your knee for 15 to 20 minutes. The cold constricts blood vessels and reduces inflammation. Do this 3 to 4 times a day during flare-ups. But here's the key. Never apply ice directly to skin. Always use a barrier. And never ice for more than 20 minutes at a time. Too much cold can actually slow healing. Now for chronic stiffness and achy knees, use heat. A heating pad, warm towel, or even a warm bath works. Heat increases blood flow, relaxes muscles, and loosens up stiff joints. Apply heat for 15 to 20 minutes before exercise or activity. It prepares your knee for movement. Here's a pro technique: contrast therapy. Alternate between ice for 10 minutes and heat for 10 minutes, 3 cycles total. This creates a pumping action that flushes out inflammatory waste and brings in fresh, healing nutrients. One of my clients eliminated years of chronic knee pain just by using this ice and heat protocol correctly. It's simple, it's cheap, and it works. Don't overlook the basics. Method 4. Anti-inflammatory nutrition. Your diet is either feeding your pain or fighting it. There's no middle ground. Every meal you eat either increases inflammation or decreases it. Let me tell you exactly what to eat and what to avoid. First, foods that fight knee pain. Fatty fish like salmon, mackerel, and sardines. They're loaded with omega-3 fatty acids that are nature's most powerful anti-inflammatories. Aim for 3 servings per week. Berries, especially blueberries, strawberries, and cherries. They contain anthocyanins that reduce inflammation at the cellular level. Have a handful every day. Leafy greens like spinach, kale, and Swiss chard. They're packed with vitamins and antioxidants that protect your joints. Add them to smoothies or salads. Turmeric and ginger. These spices have been used for thousands of years to treat joint pain. Add turmeric to your food or take a supplement with black pepper for absorption. Fresh ginger in tea is incredibly powerful. Nuts and seeds, especially walnuts, chia seeds, and flax seeds. More omega-3s and healthy fats that lubricate your joints from the inside. Now, foods that worsen knee pain. This is critical. Eliminate or dramatically reduce these. Sugar and refined carbs, they spike inflammation instantly. That includes white bread, pastries, sodas, and candy. Fried foods and trans fats, they promote inflammation and weight gain, which puts more pressure on your knees. Processed meats like hot dogs, bacon, and deli meats, they contain compounds that trigger inflammatory responses. Excessive alcohol, it dehydrates your joints and promotes inflammation. Here's the reality: you can do all the exercises in the world, but if you're eating inflammatory foods daily, you're fighting an uphill battle. Research shows that people who follow an anti-inflammatory diet experience up to 50% less joint pain. Your fork is more powerful than most medications. Use it wisely. Method 5. Weight management for knee relief. I need to be honest with you about something. Every extra pound you carry puts 4 pounds of pressure on your knees. Read that again. Every single pound equals 4 pounds of stress on your knee joints. If you're carrying 20 extra pounds, that's 80 pounds of additional force with every step you take. Over days, that's thousands of extra pounds of pressure. Over months and years, that's devastating wear and tear. But here's the good news. The reverse is also true. Lose just 10 pounds and you remove 40 pounds of pressure from your knees. People who lose 10 to 15 pounds often report dramatic reductions in knee pain, sometimes 50 to 70% less pain. You don't need to become a marathon runner or follow some extreme diet. Small, sustainable changes work best. Replace sugary drinks with water. That alone can help you lose 5 to 10 pounds in a few months. Add more vegetables to every meal. They fill you up with nutrients and fiber without excess calories. Practice portion control. Use smaller plates. Eat slowly. Stop when you're 80% full. Move more throughout your day. Park farther away. Take the stairs. Walk after dinner. Small movements add up to big results. Track your food for 1 week. Most people are shocked when they see how many calories they're actually consuming. Awareness is the first step to change. I know weight loss isn't easy, but the impact on your knee pain is so profound that even modest weight loss creates life-changing results. Your knees are literally begging you to lighten their load. Be patient with yourself. Lose 1 to 2 pounds per week. That's sustainable, that's realistic, and that's the path to pain-free knees. Method 6. Kini-friendly footwear. Let me ask you something. What are you wearing on your feet right now? Because your shoes might be the hidden cause of your knee pain. Worn-out shoes with no support? Knee pain. High heels that tilt your body forward? Knee pain. Flip-flops that make you grip with your toes? You guessed it, knee pain. Flat, thin-soled shoes with zero support? You guessed it, knee pain. Your feet are the foundation of your entire body. When your feet aren't properly supported, your ankles compensate, then your knees compensate, then your hips and back compensate. It's a chain reaction of pain. Here's what proper Kini-friendly footwear looks like. First, arch support. Your shoes should support the natural arch of your foot. If they don't, get insoles or orthotics. Second, cushioning. Your shoes should absorb impact, especially in the heel. Running or walking shoes with good cushioning are ideal for daily wear. Third, stability. Your foot shouldn't roll excessively inward or outward. A stable shoe keeps your knee aligned properly. Fourth, replace regularly. Shoes lose their support after about 300 to 500 miles of walking. That's roughly every 6 to 12 months for most people. Yes, I know shoes are expensive, but knee surgery is way more expensive. Avoid these shoe mistakes. Never wear high heels regularly. They increase knee pressure by 26%. Avoid completely flat shoes with zero support. Don't wear old, worn-out shoes just because they're comfortable.